The United States of America has the finest doctors and hospitals in the world, but the health of our nation may be at greater risk than ever before. We spend more money per capita on healthcare than any other industrialized nation on earth, but rank dead last in outcomes. Millions of Americans, including 1.7 million right here in Georgia, have no health coverage, or worse, no access to basic health care at all. Compounding the problem is the fact that enormous student debt and the promise of reduced payment are forcing medical students away from primary care in favor of more lucrative professional careers in the surgical subspecialties or others like dermatology or radiology. Many are staying out of medicine altogether.
We have found that medical students today choose other fields which are more lucrative and at the same time less demanding. So specialties other than primary care are being chosen, and therefore there is this lack. The lack has led to poor treatment as an outpatient, and as a result, patients are getting sicker. They have nowhere to go, and therefore wind up in hospital emergency rooms, and the sickest to wind up in my arena in the intensive care unit.
I think part of the reason why we spend twice as much for our care in the United States versus other countries with outcomes, by the way, that are ranked 19 out of 19 in terms of adding value in the system, is that although we have great players on the team, we have good specialists, they're not coordinating care in a meaningful way. And that lack of coordination is extremely detrimental, particularly to patients who have chronic diseases. So I can now buy a pretty good amputation for my diabetics, but it's darn hard to find the kind of comprehensive care necessary to prevent my diabetic from needing the amputation, and even harder to find the kind of care that prevents my patient from becoming a diabetic.
Some say the American healthcare system is broken, but the current environment invokes far harsher terms. Some even suggest that today there is no viable healthcare system in America.
Now the incentive for in healthcare is not what you do for patients, is what you do to patients.
If I take care of 6 problems, I get reimbursed the same as the specialist who takes care of 1. And that kind of efficiency really helps the medical care system, but that value isn't recognized. Reimbursement has to be recognized for primary care.
Our payment system now values volume. It values procedural care. It values the things that you do. It does not value health.
While government continues to search for answers in Washington and Atlanta, a new healthcare model has emerged as our brightest hope. A new delivery system supported by primary care physicians, employers, and insurers alike. A healthcare system that puts the patient at the center. Appropriately, this concept is called the patient-centered medical home.
The patient-centered medical home is a concept, a model of care designed to help take care of patients over the long run.
It's a way of enhancing the relationship between the patient and their doctor and asking that the doctor develop certain systems, certain skills, certain transparency, and certain communication with the rest of healthcare that's accountable.
It is physician-directed. It is whole-person-oriented. It is enhanced with electronic technology in terms of electronic medical records as well as electronic prescribing that tremendously increases safety for patients.
There are many, many ways of accessing the doctor in real time, not getting an appointment 3, 4, 5 months down the road. You have an issue, you have a problem, you contact your physician and you get an answer.
But what we do is we help you navigate this complicated healthcare system to get the care that you need from whether it be a subspecialist or maybe if you have diabetes and you need to see a nutritionist.
I'm the quarterback, okay? That I may be sending them somewhere else for some specialty care or something that we're not experts at, but I want them to get the best care.
The patient-centered medical home is the only healthcare model that puts the patient at the center of healthcare, working with a personal primary care physician who leads a healthcare team dedicated to providing comprehensive and continuous care. In a medical home, Primary care physicians employ systematic solutions to ensure patients receive safe, high-quality preventive services and care that's coordinated across all components of the complex healthcare system. Patients enjoy enhanced access to their physician, and physicians are paid appropriately for managing their care.
One of the central parts of the patient-centered medical home is team care. And the most important team member is you, the patient.
Since its introduction, the patient-centered medical home has transcended the conceptual and gained momentum. Physician groups, employers, and insurers alike are all touting the patient-centered medical home as the cure to our current healthcare crisis.
We are searching for answers and trying to solve the question of how can we access care for people who maybe are not able to access the current system. And we're certainly searching for ways to pay for that system as well. And I think this is one of the good answers.
I believe if we can solve two things, incentivizing advanced care where people look at you in advance and they look at wellness and they take care of you and it makes sense to them, and helping doctors afford to have the electronic health record, I believe those two steps will put us into a medical home-centered model with extraordinary efficiencies and where we actually will discover we're saving an enormous amount of money and people are dramatically healthier.
In test after test, the patient-centered medical home has proven it decreases cost, improves quality, and improves satisfaction. That's why every single primary care association in Georgia has endorsed the patient-centered medical home, along with numerous national leaders of business, industry, and government. And that's why you should support it too.
What I believe is that old family doctor is so important. We ought to allow patients to be able to make those kinds of decisions, to be able to have that, the new term, as you mentioned, is medical home, but it's just the common sense matter of having a family doctor that takes care of you and your family and is your entree into the healthcare system.
The reason that the companies are in the healthcare business is they provide the benefits with the goal being to have a healthier workforce. And that translates hopefully into a more productive workforce, and that transforms into a better bottom line for the company.
Places I've seen so far that we've gotten briefings on are spectacular on the impact of a medical home model on making sure that people have the kind of sophisticated care over time, knowledge over time, diagnostics over time that really maximizes good health and minimizes cost.
Of the payors for health care, business tends to follow government, and so we certainly want to help the state of Georgia see the benefits of doing this because it's going to save the state money, and that means the state taxpayer is going to save money.
The stakes have never been higher. Ask your primary care physician about the patient-centered medical home.